Hello everyone, it's Ryan Liberty. In this video, I'm going to answer the question, what is Body Dysmorphic Disorder, also known as BDD? Ugh.
Ooh, ah.
Okay, so Body Dysmorphic Disorder, BDD. We're going to get to what it is in just a second. I just need to explain that this is not the diagnostic criteria for body dysmorphic disorder. It's just a quick description to give you an idea of what's going on. So if you need a diagnosis, you'll have to see a licensed professional or a therapist. Do not use this information. Also, if this label of body dysmorphic disorder, BDD, bothers you in any way, if the stigma gets to you, if it just doesn't help you to heal, you don't have to use the label, you can drop it. Again, it's just to point you towards something that may be going on in your life or the life of a loved one. So what is body dysmorphic disorder? What is BDD? Well, first it was formerly known as I've got notes down here I'm checking out. It was known as dysmorphophobia in the past, and what it is it's a preoccupation with perceived flaws in yourself or blemishes or defects in your body that other people, either they see it as a minor thing or they wouldn't even see it at all. So, you're like checking at yourself and you're bothered by, you're preoccupied, always thinking about something that's going on your body. When you go ahead and show it to somebody else, they either can't even see it or they don't understand why it's bothering you, because to them it's not a big deal, it's minor. At some point, the person who has this disorder has done either a repetitive behavior around this blemish, so something like skin picking or excessive grooming, seeking reassurance from other people that they look okay, or checking in the mirror. Or they'll do a repetitive mental act, like constantly comparing themselves to other people. This preoccupation is something that interferes with their daily life, their everyday life, work, school, relationships, that kind of thing. And it's not something that would be better explained by normal concerns about weight or body fat, or something that would be explained by an eating disorder. So this is not an eating disorder. So it's something that on average, these preoccupations occur from 3 to 8 hours per day. Now that doesn't mean that somebody's, picking at their skin for 3 to 8 hours a day, although that is something that can happen with this disorder. But just the thoughts that are going through their heads of worrying about it and thinking about it, that's happening for a significant chunk of the day. It's also something, interestingly, that could be considered to be done by proxy, where you, instead of being preoccupied and focused on your own flaws, become over-focused on somebody else's flaw, and that's always something you're thinking about throughout the day. There's also specifiers for body dysmorphic disorder, just to clarify a little further what may be going on, and one of them is called with muscle dysmorphia, and that specifically is when you're preoccupied with your body thinking that you don't have enough muscle or you're too small. And even if you are preoccupied with other areas of your body as well, that can happen. You would still use with muscle dysmorphia if the person's concerned about this muscular physique or feeling like they're too small. And sometimes that will happen in some people who are large anyway. This disorder doesn't mean that those things aren't there. If I'm concerned about having a big muscly body or something and I'm a big guy already, it still could be body dysmorphic disorder. There's also the specifier of with good or fair insight, which means that you recognize that those beliefs are probably or definitely not true. There's with poor insight, which means you think that the beliefs most likely are true about your blemishes. Or there's with absent insight and delusional beliefs, which means you completely believe that those blemishes are real and they have to be fixed. So those are the different specifiers, but there is treatment for body dysmorphic disorder, and that would be something like cognitive behavioral therapy as well as medication. And I'll get to something that very often people mistakenly believe is a treatment, but actually makes things worse in just a second. However, what does it feel like to have body dysmorphic disorder, BDD? So in your actual body, you're probably just going to feel anxiety symptoms. So sweating, racing heartbeat, shortness of breath, maybe chest pain or tightness in your muscles, that kind of a thing. As far as your thoughts, you're going to compare yourself to other people. You may think things like, I wish I looked exactly like her. Why don't I have muscles like that? And you may have what's called ideas or delusions of reference. I have a video on that. But something like, I know that they're looking at my blemish. I know they're looking at it. That kind of a thing. Emotionally, you're probably going to feel a little depressed, have a low self-esteem. You may feel a little embarrassed or ashamed about this problem that you're having, this perceived problem that you're having. Remember, this may not actually be an actual problem. It's just something that you're perceiving. But it's going to lead to low self-esteem. You're going to feel a little bad about it. Behaviorally, there's a lot of different ways that this disorder can manifest. So you may avoid social situations altogether. You may drop out of school. You may become housebound and only stay in your house to avoid being seen by people. You may repetitively check yourself in the mirror. You may fix your hair, put your hair constantly back into place. You may constantly be touching parts of the body. There may be excessive styling and grooming, 3 to 5 to 10 hours of getting ready to go somewhere, over applying makeup, slabbing on lots and lots and lots on that one area where that thing is that you don't want to be there. Choosing clothes to cover up the blemishes, repeatedly asking other people how you look, excessive weightlifting, excessive exercise, frequently changing your clothes, excessive tanning or bleaching of the skin, excessive dieting. Everything is excessive here. Very often, unfortunately, people with body dysmorphic disorder, they seek out cosmetic procedures and surgical procedures, and they think that this is gonna, get rid of the blemish and make them feel better, but unfortunately, after the procedure's over, they very often are not satisfied with the results. They still feel like they can see the blemish, it's there, because it's not really about the blemish. It's about these obsessive compulsive related thoughts around the blemishes. That's what this disorder is really about. So they'll go through a surgical procedure, they'll be unhappy, and they'll go and get another one and another one and another one, trying to fix what they perceive as a flaw. And unfortunately, they'll also go and sue, if you have this, you may find you'll sue the clinician or the surgical doctor for not doing the job properly because you're unsatisfied. So it's very stressful. It's a serious disorder in the fact that, yes, you may actually alter your body and make permanent changes to it. You may harm your body taking things like steroids to get the muscles. So if this is something that's going on, take it seriously, see a professional, get some help, and get a treatment plan going on. But if you've had an experience with this yourself or with somebody that you love, I'd love to know what your experience has been. So go ahead and leave that below. But in the meantime, I thank you for taking the time to learn about body dysmorphic disorder with me today, and I hope I've given you a good, well-rounded human perspective on it. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.